Dear friends, ladies and gentlemen, it's really a great pleasure and honor indeed for me to be on the platform of Concor. You all know that Concor is a super selective beta blocker by the name of bisoprolol. It's a very unique molecule. What is the uniqueness of this molecule? The uniqueness is it is super selective. Number two, it is metabolically very friendly molecule. Number three, pharmacodynamically and pharmacokinetically it is a very stable molecule. Now what are the indication? The first indication, it can be used in young hypertensives, middle-aged hypertensives and old-age hypertensives. In all hypertensives where the sympathetic nervous activity is increased, this is the first drug of choice. As you all know that India is the world capital of hypertension. Most of the hypertensives are uncontrolled. It's like a global tsunami. The second very dominant indication is heart failure. We see so many patients of chronic heart failure. Even heart failure with reduced ejection fraction, acute heart failure, even de novo heart failure, or heart failure sometimes with a middle range ejection fraction. It is a drug of choice. Why it is so? Because most of the heart failure patients have increased SNS. So this is the drug of choice with enormous number of benefits, and these benefits are CVD mortality reduction, all-cause mortality reduction, and most important out of all is reduction of sudden cardiac death. MACE reduction, even the worsening of heart failure is also reduced. So this is enormous benefits of bisoprolol. Third indication, number of tachyarrhythmias, whether atrial fibrillation or supraventricular tachycardia or sinus tachycardia. Fourth indication, all kind of cardiomyopathies, maybe dilated cardiomyopathy, hypertrophic cardiomyopathy, or even restrictive cardiomyopathy. It is also a drug of choice in thyrotoxicosis. It can also be used in anxiety state, in migraine patients. This is also a drug of choice. Ladies and gentlemen, we have seen a lot of patients of stress cardiomyopathy. And these patients of stress cardiomyopathy, this is the drug of choice. Especially in the post-COVID era, we have seen a lot of patients coming to us with a post-COVID cardiomyopathy. So bisoprolol is a very powerful and promising molecule wherever there is a increased SNS activity. One thing I want to clarify today, this drug has no effect on the erectile functions. So this should be away from our mind. And second point also I want to say, there is some myth that it causes some cognition abnormality. There is no cognition abnormality at all. This is the drug of choice. So bisoprolol is on the top. It is an iconic molecule of the century. It is also a game changer of present and future in all the cardiovascular disorders. Thank you very much for giving me this honor.